campus. And they may, typically they're still under their parents' insurance. And so some of these students may contact their primary care physician from whatever campus they're on and need either questions about medications or maybe some illness they have going on. And so these are common examples of how we deliver virtual care to that population. And the last patient story I have is related to, it's a personal story, and it's related to my mother, who was diagnosed a couple years ago with breast cancer. And for those of you who had dealt with cancer either personally or as a family member, you know that the diagnosis is just the beginning. There's a whole coordination of care that happens afterwards that can be really complex and really confusing. There's the consultation with the oncologist. There's imaging tests and lab tests. There's consultation with the surgeon. There's a discussion about risks and benefits with procedures that you can do. And I went through all of this with my mom and our family. And one of the things that I learned firsthand was just how confusing it really is. And I also learned that so much information is given to you during these office visits that it's almost impossible to remember everything. And one of the things that it really inspired in me was, as we're building out this new digital healthcare capability, we really need to take into account that all this information that's conveyed needs to be accessible to the patient and their family, and in an easy and friendly way. And so in coordinating my mom's care, usually my sister or I would go to the office visits, and we'd actually take notepads and be writing down everything the doctor said. We would also be helping her coordinate the visits, talking with the care team that was coordinating the follow-up appointments, the imaging tests, the lab tests, and mapping that all out on the calendar. Once she went through surgery, we had to do essentially the same thing with the pre-surgical care, the surgical care, and then the post-surgical care. All of that coordination and follow-up was pretty much relegated to the family members to make sure that everything that my mom was supposed to do to get better, she was able to do. And the good news is she's had a recent video visit with her oncologist. She's been cancer-free for a couple years now, and things are looking really good. So we're really happy ending as that story. But one of the lasting messages that I took away from it is we got to make this better. And so part of what we're going to be focusing on is how we really improve that experience for patients. So this slide is a lot of text, I realize, but what it is, these are the comments from patients about the virtual care experience. And so when coronavirus first hit the United States, in terms of its peak around March, most healthcare systems had to rapidly switch to this virtual care offerings. And in fact, most of them, including our own, Sharp here in San Diego, about 70% of all our visits were virtual. Now before that, it was 1%. So you're talking a rapid increase in virtual care almost overnight. The good news, as you saw in the video earlier in the presentation, we've been doing this since 2015. So we had a pretty good track record of how to scale it up, ramp it up quickly. But at the same token, it was a massive undertaking, and we were really concerned that our patients felt disrupted, that they couldn't come into the clinics and do their normal in-person exam room visit. So we asked them through patient surveys, through social media, to let us know how these virtual care services went for them. And fortunately, as you can see some of these comments on here, they were really happy that they were still able to get the care they needed without having exposed themselves to potential infections in the clinic or just traveling. And for them, it was a really good experience. So a couple emerging trends in terms of what's happening in the future. Some of you may have heard about Amazon has recently gotten into the healthcare market with their Halo band. And the Halo band is kind of interesting in the sense that it's really, really simple. There's no screen, there's no complexity, but what it's doing is listening to the environment around you. And yeah, I know, it sounds a little creepy, but part of what they're saying is that by detecting your voice and how you're speaking and how you're interacting with others, it can measure your mood. It can kind of plot, how you're doing throughout the day and over time, and can give you useful feedback on how to improve things. It's relatively new. There's still a lot of research to be done on it. The Apple of course, has their Apple Watch. They recently released the version 6 of it, which has not only the EKG built into it, but a pulse oximetry device. And so I recently picked one up because I have chronic obstructive lung disease that, for me, requires pulse oximetry. It's for me to monitor my blood oxygen level just to make sure I'm not having any issues with my lungs. And so this device is a way for me as the patient to take a little bit more control over my own healthcare. And that's kind of the bottom line emerging trend that I want to convey to all of you, is what's happening in the wearable space is a movement from taking everything that normally happens in the doctor's office and bringing it out to the patient. It's also cheaper in the sense that you don't have to go in and pay a copay visit every time you want to, do an EKG or check your heart rate or detect for anything going on in your health status. The last item up here on the right is a little kit. It's called a TidoCare kit. You can buy it at Best Buy for $200, $300. And what it is, it's a kit that has all those devices that are in the doctor's office exam room. It has the device to look in your ears, to look at your throat, to look at your pulse and respiratory rate. And this actually allows you to, at home or wherever you are, essentially have your vitals and exam done, and the doctor can in real time or afterwards, because you can record all this information, review your visit data and then make some medical decisions just like he or she would in the doctor's office. So what's interesting about Best Buy is, they recently acquired a healthcare company here in San Diego that provides remote monitoring services for patients. You may think, well, what Best Buy? They sell TVs and computers and audio equipment. Why would they be getting into healthcare? And one of the reasons is they recognize that this is an emerging market and that patients want to be able to track more of their healthcare at home and not have to come into the doctor's office each and every time. So Best Buy already has an entire team of healthcare technicians ready to come into your home and help you set these up. And you know what they're called? That's right, the Geek Squad, right? So they are retraining their Geek Squad staff to come into your house, install these health devices, just like they would install a TV or stereo, and get it all set up for you. And that way you can remain connected to your doctor and your healthcare system pretty easily. So to kind of wrap things up, I want to start talking about the future and what are we building. So this slide represents sort of a roadmap of what we're building now. And essentially the way to look at it is just a way to coordinate your doctor's office visits, when you're due for things, being able to easily connect with your healthcare system, whether it's through email or text or regular phone calls. We want to build all of that into this environment. We also want to make the front door really easy to access and not be confusing. And the idea is so that you have a virtual team of people who are going to be looking after you outside of the doctor's office and going to be letting you know when things are due or overdue, communication about your health status. It also gives you the opportunity to ask questions, to review education, to look at your own healthcare record, because what we're going to be launching in November is publishing essentially every patient's medical record to themselves. And not just a summary, but actually what the doctor sees in front of them is the same thing the patient's going to see on their device, their own progress notes and medical record. The other thing that we're really doing to create this experience is we're focusing on this concept that we call website manner. And it goes back to what I was talking about previously, which is how do you bring that magic that happens in the exam room, that experience, into this virtual realm? And so we are actually training our physicians and staff to do that. And there's a variety of things that we have to do, but a lot of it, is listed here on the slide. But the main thing that we're focused on is how do you make that video visit special? How do you make that secure email express empathy? These are the questions that we're addressing and going to be focused on in the upcoming years. So, to conclude, I actually have some questions for all of you. What do you want from telehealth? Number one, what is the most important element to make it a good experience? What does website manner mean to you as the patient? Number two, what advice do you have for physicians, nurses, healthcare providers to improve the way things are? Number three, and what do you want to see improved in the future? What are you excited about? What are you perhaps a little bit fearful of? And what are the things that you need to take care of yourself? And I'm here to listen, and I look forward to your questions and comments. Thank you very much. Before I get to the questions, there's one announcement I wanted to make is that the team here is aware of the technical issues with the Zoom. We appreciate your patience as we work through them. And we've set up an alternate YouTube stream if Zoom's not working for you. So please check the chat for that link to YouTube. And yes, I do realize the irony of having technical issues when I'm talking about virtual care and telemedicine and telehealth. So let's get to the questions. I've been warned by my endocrinologist that insurance companies may not allow us to continue telemedicine after the pandemic. What is the medical profession doing to make sure this will continue? And this is a really common question. What's going to happen after this pandemic is over? Are these new coverage policies going to continue, or are they just going to be dropped and we'll go back to the way things were? I don't have a crystal ball, but from all the industry experts that we've been in contact with, including legislators in DC, the intent is not to go back to where we were. The head of Medicare and Medicaid Services herself has stated, it's going to be hard to put the genie back in the bottle once all the patients and the physicians realize that this is a proven way to deliver care. So in terms of what the medical profession is doing, all of our physician groups or advocacy groups, they're heavily promoting that these services continue and continue to be covered for you. What you can do to help is, reach out to your local congressman or the election's coming up, so vote wisely and we'll see what happens. Another common question is, what if your devices that you're using will not download the doctor's or healthcare system's app? And that kind of goes back to what I was saying earlier is the best delivery platforms are ones that don't require you to do anything, right? Where you can just tap on a link and be there with your doctor. That being said, there are some restrictions based on the type of device you have. So my advice there is if you have a device that's not compatible with what is being offered by your healthcare provider, contact them and see if there's alternatives. So for example, we have 2 or 3 backup systems we could use potentially if our primary system doesn't work. And some of those backup systems may work on the device you have. And we did that deliberately, knowing that there's a mix of hardware and systems out there, and we did not want any patient to not be able to access this because of a technological barrier. Another question is, telehealth costs are not only just my copay, but also the amount billed to Medicare and Medicare Advantage. So is a visit based on the 15-minute, the 30-minute, and can I determine that too? Sometimes, and that's a great question, and it has to do with what we call price transparency. And there's a lot of work underway to, just like any other industry, to let you know what things cost and what you're going to be charged. Now, in the case of Medicare Advantage, you're fortunate in the sense that most of those services are covered under sort of an umbrella evaluation and management service. And so generally the share of costs tend to be pretty minimal. But that being said, it is perfectly okay for you to get a copy of your bill from the healthcare provider, or ask in advance, what you think the estimates of the costs are going to be. And that way you can decide, is that too much? Would I rather pursue an alternative mode of care? Or you can have a conversation about how to make things cheaper for you. And an example is raised by the person who asked the question is, sometimes these visits can be done in a shorter amount of time. And that has to do kind of with what I was talking about earlier. If you can get some of your questions and information to your healthcare team ahead of time, some of your history, some of the things that maybe these at-home diagnostic or monitoring devices track now in terms of your vitals, your health status. Sometimes getting that information ahead of time can make your visit shorter. And some of those questions that would normally be asked during the visit that take time could be answered ahead of time through some of these secure messaging technologies. And your visit being shorter will often result in a lower charge. I mean, not always, but in some cases, and therefore a lower cost to you. Another question has to do with privacy, and it says that telehealth logs for my visits are being stored on my computer. Why were we not told that? I thought it was totally private. And that's a great question. I mean, as far as I know, most of the systems that we use are not logging anything remotely on your computer. They do sometimes take transaction logs just so we can measure whether the connections are valid. But in terms of the actual encounter, what is said, it's not being recorded, at least not in our case. And generally, if anything is going to be recorded or logged, the healthcare provider that you're those logs are, and maybe if there's a way to opt out of them tracking on your computer. Another question has to do with mental health through telehealth, and this is before the pandemic. Mental health was the fastest growing segment of telehealth, and the reason was primarily because of a shortage of mental health care providers. It's really hard to find healthcare professionals in this field and have enough to meet the demands of all of our patients in the community. And that being said, mental health actually emerged as one of the best delivery capabilities through telehealth, because a lot of it doesn't require, the hands-on physical examination or procedures. It's really more the diagnostic part of it is the back and forth between you and the professional. And so mental health actually has a lot of service offerings in the telehealth arena, and it's growing even further. In our case, we have an actual hospital, the Sharp Vista Hospital, is dedicated to services to patients remotely, or even if they're in another facility, like in the emergency department, for example, they can connect to that emergency department, assess the patient, answer the questions, provide mental health services without them having to travel or us having to travel to them. When I see my MD, one of the first things he does is listen to my heart. it seems like this and many other aspects of the traditional office visit are not possible with telemedicine. And am I missing something? And yeah, and that's true in some cases. Some of those vitals that we take during the routine office visit are not easily done when you're at home. However, every month that changes. New devices like that Best Buy setup I mentioned previously, the Apple Watch, for example, can do an EKG on your heart. There's home blood pressure cuffs, like my parents have a home blood pressure cuff they use that can, allow them to take blood pressure. So there's a lot of these things that can be done at home by yourself, and that way you can still get that portion of the physical exam completed. And there's even new technologies coming out with smartphones where you can actually hook on like a little ultrasound device and they can actually listen to your heart and lungs connected to your smartphone. So I imagine that those limitations are going to be going down further and further as we develop more modern tools. Question is, how will you train your providers to interact with people of color? And this is something, being a multi-specialty medical group and having multi-cultures, backgrounds in our group, it's something we took very seriously, and we actually do internal training for cultural, racial, religious differences so that physicians know how to treat these patients appropriately and respectfully. It's something we hold really dear to our hearts. So I think what we're doing in that regard is just education and people sharing stories. And we even have physicians who tell their own stories when they were treated unfairly and how that made them feel and how that affected their life. Terms of agreement shouldn't do that, so I hope you're not forfeiting all your rights. But I've read through some of those 300 pages of text, and they do sound very onerous. But rest assured, if you're not do what's most comfortable for you, and if you have questions, ask your healthcare provider. Bringing you all these incredible talks and knowledge and sharing, and I appreciate your time. Thank you.
Hello, everyone. My name is Todd Durkin. I'm the founder and the creator here of Fitness Quest 10 in San Diego, California. And as a coach and as a trainer and as an author, one of the things that I'm inspired to do is help people just like you be the best that you can possibly be. For the next couple of minutes, I want to help you with just a couple different stretches that'll open your body up and it'll get your mind right. I have a book. It came out in this past June. It's called Get Your Mind Right. Get Your Mind Right. So right now, if you can just take a couple minutes to relax and enjoy, we're going to do first thing. Take your hand over your fist, place it right at your belly button, and take 3 nice deep breaths in. Shh. Let me hear your breath. I want to hear your breath as you breathe in nice and deep, and then breathe out. Breath starts everything. We breathe 18 to 22,000 times a day. And as we go into today's stretch, on this little stretch break, shout out to Oasis Tech Fair here, and for you joining so that you can get better today. The breath balances and centers all that's going on, and that breath is a vehicle. So right now, take one hand in front of the other, take the opposite hand and pull it in to stretch out the back of your shoulder. So we're just going to pull that in. Continue to work on your deep breath as you stretch. Good, good. Typically, we like to hold these for about 20 to 30 seconds. Switch it on up, other way. You should feel the back of the shoulders here as you stretch the back of the shoulders. Sometimes they get tight from sitting a lot, from being stretched throughout the day. And as you breathe in nice and deep, we're stretching that. Good. So the posterior delt, back of the shoulder stretch. Next, interlace your fingers, put them behind your head, and take your elbows and press them back away from you as you do somewhat of a mini back bend looking up toward the sky. Good. Let me see that again. And just stretching back, really far back. Good, good, good. And then coming back to neutral, and then rotating one direction and rotating the other direction. You're back in your fourth. You're rotating left and right, rotate. Just back and forth. You're swiveling. Your feet are just about shoulder width apart as you rotate left and right. Rotate back and forth. That gets the you possibly can. One more time, lean back as far as you possibly can. Reach. Good, I love it. Spinal health, and then lean forward. So you're going to nose dive down as far as you possibly can, reaching down toward the ground. Good. Taking your hands down as far as you possibly can. Wherever you stop is good. And then come back on up, reach back over your head again. Good, like a back bend. And then into forward fold, all the way down, reach forward toward the ground. Very good, very good. And this is really lubricating your spine, spinal health. One of the things I learned as you go through this movement of forward fold and then a little back bend is I herniated 3 discs in my back many, many moons ago. And one of the things I've done on my own journey through life and healing my own back pain is stretching and breath work and meditation. Very, very important. Doing these types of stretches will help get your spine flexible. If you're always sitting, you're going to stretch out. You're going to tighten your hip flexors down. We don't want to do that. One more time with a back bend all the way back as far as you can, and then forward fold as far as you can. Very good. You're doing a great job.
Hello, my name is Mary Burns. I'm an instructor for San Diego Community College District. I work out of continuing education, and I also teach classes for Oasis. This presentation, Can You Trust That Website?, is all about trust and reliability. When it comes to healthcare, this can be very important. I do want to begin with the disclosure. The information that I'm providing you with is general and based on recommendations by healthcare experts. Your opinions may differ. What will you learn today? First, we'll learn some steps to find reliable health information on the internet. Then, we'll look at some recommended health information websites. Finally, we'll look at some tips for finding useful health information and how to avoid those sites that are not reliable. First, some steps for finding reliable health information on the internet. You want to first, in step one, look at who is behind the information. You'll see that in About Us. A reputable website will include this About Us section. This section should be written in a clear, authentic, and transparent way. It should include some information about the company and/or the originator of the site. It should include appropriate qualifications and information about the people who contribute to that site. It may include a mission. In addition to About Us, look for other links with names such as our sponsors, privacy policy, or the editorial board. If you can't find out who runs the site, you should be suspicious. The domain name identifies who owns the site. A domain extension is the 3 letters that follow a dot in the domain name. For example, with oasis.net, the site is owned by Oasis, and .net is the domain extension. In some cases, a domain extension may indicate the professional nature of the site. In the past, there were several domain extensions that could be trusted. However, anyone can now get a domain extension of virtually any type except for 2. Sites that end in .gov, these are sites run by the government, and they're pretty reliable. And secondly, .edu sites, those are sites that are run by universities or medical schools. .net and .org may be authentic, but you may have to go further than the domain extension to establish authenticity. Sites ending in .com are often commercial, and they may be selling products. But understand that with over 1,000 domain extensions and no rules using any of the extensions except for .gov or .edu, a site may not be identified as reliable just from the domain extension. A website should make it easy for you to get in touch with the webmaster or the organization that sponsors the website. It should give you a phone number, email address, or other contact information. Step 2, what is the purpose of the site? Consider the reason why this site was created. Look for a goals and mission page. The mission defines the purpose of the business. It should focus on how the site strives to meet those goals. Ask, was this site created to educate and inform? Or was the site designed to encourage you to buy a product for a particular disease or illness? At this point, it's important to be able to separate the facts from the opinions. If a site appears to be based on opinion, it may not. It may appear as a general website, but may have additional tabs, pages on the site that will lead you to a product. Even if they provide useful information about a health condition, if they're promoting a product, the site may not be reliable. It's possible that the information they include is biased in a way to support their product. You will want to see that the information is backed by science. Beware of sites that rely on testimonials. This may be people who are being paid or somehow are involved in the company and not necessarily speaking entirely truthful. There should be scientific evidence on this health website. Along the same lines, beware if the site is anti-science or anti-government. This is a red flag on the accuracy of the site. Although a government site may have been unreliable at certain times, such as maybe during the initial COVID, you can still assume that their information is accurate, and the purpose of the site is to educate and inform in the best way that they can. Consider the alternative. If a government site cannot be trusted, then which site can be trusted? Step 3. Who wrote it? Who reviewed it? If the person or organization in charge of the site did not write the material, the original source should be clearly identified. Don't trust sites that don't say where the information comes from. There should be information about the medical credentials of the people who prepare or review the material on the website. Even if the author is not a medical professional, the article should pass a review of medical professionals and provide scientific background on their claims. Look to see if the author is affiliated with the website. If they stand to benefit from the exposure, it's possible that that article is biased. You can look to see if the author has published in other publications. Often, an article will link to the biography of the author, so just take a look and see how they stack up. A reputable website should include articles from professionals who are not necessarily affiliated with that website. If the website is owned by a doctor, and that doctor is selling products, and that doctor is writing articles for the website, well, it may not be as trustworthy as an unaffiliated doctor writing for a website. A good health website that is including important studies or research and is not necessarily written by a healthcare provider should at least be reviewed by a healthcare professional. Also, if citing research or a study, the article should include sources that you can visit. They might include links, but if you check them out, you may find that the link is also not from a professional site, or that it might not be saying what the author is saying. Don't just take their word for it. Look up the citations to see what the study is about and see if that matches what the author is suggesting. You should be able to contact the site or the author with questions. If no contact information is given, you can't be exactly sure who the author is. If there's a comment page, you should be able to see the comments. And what type of response has this article had? If the responses come back to personal testimonies about the product in the article, well, again, those comments may not be reliable. Not all websites are factual. Steer clear of testimonial sites, blogs, and social media. These may be biased sources. Step 4, what is the privacy policy? A website will have a privacy policy included. Look for the privacy policy or an all our policies section to see what information about its visitors the website collects and why. Routinely, websites track visitors to determine what pages are used. In addition, some sites may require visitors to subscribe or join. They may even require a fee. They may also allow the website owners to collect personal information about their visitors. Many commercial sites sell aggregate data about its visitors. For example, if you're researching breast cancer, the site might ask you if you have breast cancer. They can then use this information to sell your data to companies which deal with breast cancer. Look for the warning that comes up when you open up the site. Law requires that you're informed before viewing a site if the site will collect data from you, which is known as cookies, and should also say what this data will be used for. If you continue, and you click on continue, understand that they will be using your data. They may also collect information such as your gender, your zip code, and your birthday. If the site is asking for personal information, it should specify what the site will and won't do with the information. So be wary of what you tell these websites, especially in cases where you're dealing with a sensitive health issue. And don't sign up for anything you don't fully understand. If you're signing into a site or providing sensitive information, make sure that site is secure. Look for the HTTPS at the beginning of the web address and a lock. Most sites should not ask for a very sensitive type of data like the Social Security number. Be wary of that unless you're on a site which is going to be delivering healthcare to you. And only share your Social Security number on secure sites that you are certain are safe and authentic. Don't use public Wi-Fi when entering your personal data. A public Wi-Fi may have a hacker positioned somewhere between you and the website. So in this case, you're sending information to the hacker, and then they're sending it to where it belongs. In that case, the hacker has access to all that information, whether that be a Social Security number, a credit card number, or your medical records. A Wi-Fi which does not require a password is a vulnerable one. Use your cellular connection for sensitive data, or reserve these communications for when you can be on a locked network. Step 5. When was the article written? Websites should be reviewed and updated on a regular basis. Medical information should be current, and the most recent updates should be noted. These dates are usually found on the top or the bottom of the page. If there are a lot of broken links on the page, it may not be up to date. Beware of new studies. It's not that they're deceptive, but they may be preliminary, and they may need additional studies to confirm. Many times a study will be cited as though it's the final word in a popular website. An example of that is a test of masks that was done a few months ago. A study looked at several face masks and found that the neck gaiter, the mask that you wear around your neck so you can then use it to cover your face, was the least effective of those tested. The Washington Post took that study and created a headline, "Wearing a neck gaiter may be worse than no mask at all, researchers find." Turns out this research was not definitive, and this headline was not an accurate depiction of the study. They had to backtrack, but not before it was tweeted and reposted across social media, and as a result, there's a lot of people who believe that neck gaiters are worse than no mask at all. Step 6. Does the website offer a quick and easy solution? Is there a miracle cure mentioned? There's no quick and easy remedy for most illnesses. If the site is suggesting that a remedy will cause a disease, will cure a disease, or that a remedy will cure multiple diseases, it's probably fake. If it sounds too good to be true, it probably is. Be especially cautious about a promise of quick, dramatic, or miraculous claims. Beware of dramatic writing. This product will save your life. Or cures too good to be true. This pill will cure Alzheimer's and restore your memory. Look out for claims that a product will cure a variety of illnesses, products that are considered a breakthrough, or a product that relies on a secret ingredient. Also, be cautious of technical jargon on the website. A consumer-friendly site should have simple language that's easy to understand. Follow up with the topic by comparing that information with other websites. Can you find the same information elsewhere? Can you find the research that you just read about summarized but in a different way? Google that information and then look at some other sites. If this site is claiming something that you can't find on other reputable sites, it can't be trusted. Now, you may see this information on other sites, but then you have to make sure that those sites themselves are legitimate. Sometimes businesses will post multiple accounts of the same inauthentic information. Sometimes you just need to dig deeper to find the truth. And of course, we've already mentioned that you may be on a reputable site with misleading information or misinformation. Understand that health is a constantly evolving topic, and that something that was widely believed in the past may longer be considered true. This is not because the site is trying to be misleading or provide false information, and that's why it's important to double-check your research. Let's look at some recommended health sites. Medline Plus. So Medline Plus is run by the National Library of Medicine and contains a medical encyclopedia and detailed information on medical conditions, prescription drugs, and herbs and supplements. It gives you access to Medline, which has publications and summaries from all the major medical journals published in the English language. The National Institute of Aging. This website offers numerous informative publications and consumer guides and leads the federal government in conducting and supporting research on aging and health and the well-being of older adults. It publishes information on the nature of aging, the diseases and conditions associated with growing older, and it tries to offer tools to extend the healthy and active years of life. Daily Med. Daily Med provides trustworthy information about marketed drugs. It's that official provider of the FDA label information. The website provides a standard, comprehensive, up-to-date look. You can download the medication content and the labeling from the package inserts directly from this site. It's provided by the National Library of Medicine as a public service and does not accept any advertisements. The Mayo Clinic and Johns Hopkins, they both have websites devoted to health. The Mayo Clinic website is owned by the Mayo Foundation for Medical Education and Research and is funded through donations and grants. It provides information on medical conditions, medications, diseases, and procedures geared towards the lay reader. Most articles include a list of symptoms, diagnoses, and treatments. Johns Hopkins is a legitimate source that uses scientific sourcing. It follows the scientific method, it's unbiased, and it doesn't use emotional words in the context. They use a consensus of experts in the scientific community, and their information is peer-reviewed. The National Institute of Health Office of Dietary Supplements. This is ad-free, scientifically verified information about vitamins and supplements. It was created by the Dietary Supplement Health and Education Act of 1994, and it covers the science behind dietary supplements. Its mission is to strengthen your knowledge and understanding of dietary supplements by evaluating the scientific information, stimulating and supporting research, disseminating those research results, and educating the public. It provides direct citations to peer-reviewed articles. HealthFinder. HealthFinder is one of my favorite health websites. It's run by the U.S. Office of Disease Prevention and Health Promotion and includes an online health library that tells you about treatments for hundreds of different kinds of health conditions. There's links that can help you find a doctor and other health providers depending on your needs. Center for Disease Control and Prevention. This is a consumer-friendly website. It's run by the Federal Center for Disease Control and Prevention and includes information on hundreds of diseases and health conditions, including conditions that are common in different stages of life or for different groups of people. It has health-related information and advice for international travelers. My Medicare Matters. This is sponsored by the National Council of Aging, and it provides a variety of interactive materials on Medicare and provides free one-on-one assistance with selecting and enrolling in health care coverage. Besides that, you can find ways to stay healthy, get tips for drug coverage, and find resources to help pay for medication, and more. There are some tools that you can use to help determine the reliability of that website or article. One of these tools is called Health Web Navigator. This site reviews health-related websites and provides an unbiased look at the site. The goal of the site is to connect with accurate, easy-to-read, and up-to-date health information. It uses a team of medical professionals and usability experts to come up with the sites. The Health Web Navigator uses 50 different reviewers and will assign at least 2 reviewers to every website to corroborate on the ratings. The review takes into account the content of the site as well as the usability. So they use 4 different criteria in the review. First of all, they want to see how easy this website is to use. Next, they want to look at the visual appeal. What does it look like? They'll look at the layout and the way it's put together. They'll look at sites that look like they're professionally designed. They also look at the quality of the site. In this case, they use a tool that was developed by the UK's National Health Service. This questionnaire covers things such as your clear purpose and mission, whether it achieves that purpose and mission, whether the content is relevant to the readers, whether it provides adequate references, whether the content is unbiased and balanced, and whether there are additional sources of support and information. And then finally, they evaluate credibility. This is a way the website discloses who wrote the content, the qualifications of the writer, how current the information is, and any financial motivations of the site. Then, based on this review, the site can be given one of three ratings. Highly recommended, those are scores that rank highly in both content and usability. Recommended, those might be reliable, but maybe not as user-friendly, or it might have a little bit of information that is limited or not up to date. And not recommended, sites containing inaccurate or questionable health content. In this case, the reviewer suggests that the readers avoid the site. The beauty of this site is that you can start with a reputable website and then go to your health topics from there. The websites have already passed the authenticity test. You can search by topic, general health, mental health, senior health, and more. When selecting a topic, you're presented with a list of reputable sites. This is a good way to begin your search for reliable information instead of going on a post from Facebook, which may not be reliable. If you see a post that cites a media source, how do you know if that media source is biased or not? Now, almost all media is biased in a certain way, except for a source like Reuters, which only lists facts. But nevertheless, it's helpful to see if the site is biased in a certain way. A small bias isn't a big cause for alarm. You just have to be aware that it has that bias. But a strong bias can lead you on a path that's not accurate. So this site, Media Bias Fact Check, uses a methodology which looks at the facts on the site and then determines whether they're truthful or whether they're biased. The site itself acknowledges that there's really no scientific formula that determines bias. There's objective measures that can be calculated, but much of the information is subjective. After reviewing a website, the reviewers will provide the rating on a scale. It will be an arrow with the yellow dot showing the degree of bias for the source. You can then look at a detailed report to find out how the rating was given. When calculating the bias, they're looking at the political bias, as well as how factual the information is, and whether they supply links to credible, verifiable sources. A particular rating may involve a degree of political bias or factual ranking. In some cases, it might be both. The website also acknowledges that the bias scale is based on the USA political scale, where the Democratic Party is left center, and that's how they are able to establish the amount of bias in each of these sites. So as an example, the site ranks 3 common news sources in their reading. So first you have CNN, and on the scale, it's on the left, and then you have Fox News, and on the scale, it's on the right. Neither of them are the extreme left or right, and actually they're both nearly identical in where they stand on their side of the scale. Reuters is almost dead in the middle. It's the least biased. The site tells us that 95% of the advertising revenue comes in the form of 2 third-party advertising companies, Google AdSense and Newer Media. They use third-party advertising so that they will not have media influence. They acknowledge that there are cookies that will supply ads to the readers, but they have no control over the ads that you see. Because their revenue is based on these third-party ads, their mission is to provide quality content that will bring people back to the website. Additional sources of revenue include membership fees, which are currently $50 a year, and donations. And donations are limited to individuals on PayPal. Donations from corporations, businesses, foundations, politicians, and political parties are not accepted. So you can use this website to determine how biased and factual your site might be. A quick summary of this presentation. Let's review the steps to determine if a website or health article is reliable. Step 1, look at the sponsor. Who's the sponsor? Look at About Us to see who's behind the site. Look for those additional clues like sponsors, privacy policy, editorial boards, and of course, review the domain name. Step 2, look at the purpose. Is the purpose educational or is it to sell something? Step number 3, who wrote it? Is the author listed? Are they a healthcare provider? Do they have anything financially to gain in writing the article? Was the article reviewed by a healthcare professional? Step 4, privacy. What is the privacy policy? Do they collect your data? What do they do with that data? Step 5, when was it written? Is it up to date? Is it brand new? When was it last updated? And then step 6, does it offer quick and easy solutions and miracle cures? Unfortunately, there's really no quick and easy solutions to most healthcare issues. If it offers one, it might be an unreliable source. Next, we talked about 2 tools that we can use to determine the reliability and truthfulness of the site. So use Health Web Navigator to begin your search on health information using the recommendations provided that are either recommended or highly recommended as ranked by their reviewers. Use Media Bias Fact Check to look for biases and or the accuracy of facts on a particular website. And that concludes the presentation. If you'd like to contact me with questions or comments, I can be reached at maryburns@sdceonline.com. And thanks so much for listening. There. Hello, everyone. And I just received a call out that I pronounced Reuters wrong. It's Reuters. Thank you, Jane. Anyway, I'm going to answer some of your questions, but I want to preface this by saying the information I gave is general. And so I don't know that I'm qualified to say one particular site is better than the other. I offered some tools, and these are the tools that I would use to decide whether a site was good. But sometimes it's kind of up to you. You have to see what they're promoting. But much of the information that we talked about, such as testimonials and based on science and that type of thing, that is something that you would want to consider. So going to some of the questions, people are asking about specific sites like MedPage, Medscape, WebMD, and WHO. I obviously didn't mention all of them. So of those, I don't know that I'd have to go back and look at them. But I think Medscape I know is a reputable one, and WebMD is okay, but it sometimes has a little bit of health promotion on there. But again, as far as the sites go, generally, many of them are great. Every so often, you might have some issues with them promoting a particular topic. All right, let's go down and see. Major red flag is your doctor doesn't want you to know this. Yes. And maybe let's just go, and I'm just going to show you the websites. We're not going to play with them, but I'm just going to show them to you live. I don't know if I can do this, but I think I can. No, I'm sorry, can't do this. So you would want to go to the 2 websites are, and you would want to check these out at your own leisure. Health Web Navigator dot I think it's .com, .org. Okay, healthwebnavigator.org. It's not working here. There we go. Or Media Bias Fact Check.
Amy, will you send those out? All right, I guess I can share screens now. So let me just share these for you. So I'm going to share the media bias fact check one with you, so you can see that. And this is the site. It's mediabiasfactcheck.com. And maybe to get started, you just want to look at the least biased websites. So these are ones that are not necessarily going to be sending you down a road where you're going and looking at things that are very biased one way or the other. And then the other one, which is more connected to today's topic, is the Health Web Navigator. So in this site, you've got, first of all, recent reviews. Somebody was asking about Medline, I think, and that is recommended. So they would either come recommended or highly recommended. You can also go to different areas and look for different things about, let's say you want to find a health website that is good on diabetes. So you would type in diabetes, and what they have done is they have gone and looked at some of these sites and studied them to see if they are truthful in what they do, or if they're trying to push maybe their agenda. So just go back and look at these when you get a chance. And let me go back and see what some of the other questions are. I think I have some people holding their hands up. So let me see. Just type your questions into the search box. If anybody have any questions, type them into the search box. Okay, somebody said, all right, let's see. Karen, do you have a question? I'll allow you to talk. Karen, you have a question? If you can unmute yourself.
Yeah, hi. I was wondering what those, you cited news and Reuters.
Oh, what I was doing there was I was using that media bias fact check site, and I was demonstrating how they fall. So if you go into that media bias fact check site and you type in CNN, you'll see that it falls kind of on the left side of there's an arrow that goes left biased, right biased, and it just shows the whole stream. So CNN kind of falls, near the left side. Fox News kind of falls near the right side. And they're almost identical, but they're just on opposite ends of the triangle or the arrow. And they're both mostly factual. So, you kind of have to keep that in mind when you're looking at those two sources. And we're only working on today we're talking about health-related things, but that's true for most kinds of news. So get used to looking at some type of fact check organization, whether it be one of these or whether it be, the Health Web Navigator. Okay,
Thank you.
You're welcome. Media bias. So that is, Amy, would you type that in for us? That is mediabiasfactcheck.com if you get a chance. Okay, so Barbara, you're next. Unmute yourself if you can, and you can ask a question. Barbara, you still there? Barbara or Rob? You have your hand up. Okay, let's move on to Harley. Is that right? You want to unmute yourself and ask your question? Go ahead.
Are you speaking to me?
Yes, I am. You had your hand up.
Thank you. Was it Medicare, mymedicarematters.gov? Was that it?
Let me see. It was
the other one.
I don't have my hand out in front of me, but let me see if I can find it. I think it was right here. Yeah, let's see. I'm not exactly sure. Oh, here it is. Okay, so the one I recommended was No, it's not on there. I think it was My Medicare something. By the way, these presentations will be available on the Oasis spot later on, so you can check them out. MyMedicareMatters.org. Thank you, DFE.
Okay, thank you. That's all.
Okay, excellent.
Thank you.
Okay, you're welcome. Hunowitz, Carrie, do you want to say? You can unmute yourself. While we're waiting, if somebody asked if you have to pay $50 a year to use Media Bias Fact Check, no, you don't have to pay anything. It's free. I think that they would like some donations if they can, but you can go and look at it anytime and it doesn't cost anything. We can have a copy of the handout and the presentation available. We'll talk to Amy about that. So maybe we can have that up on the website if you need it. Let me see, who else had their hand up? Larry Ensler, would you like to say something? You'll have to unmute yourself.
Yeah, I missed the link for how you the health link on mediabiasfactcheck.com.
So that would be mediabiasfactcheck.com. Okay, but like we said,
Right.
we've run out of time now, so I apologize for that. But the presentations will be available on the website following the event, and we will thank you for coming. And if you have any questions, you can email me at maryburns@sdceonline.com, and I will type that in, and then we'll have to kind of cut it short. So thank you so much for coming. Sorry about the technical difficulties, but that's what happens when you put on a huge event for so many people. All right, thank you.
Good morning, everybody. I'm Bruce Peckman, the muscle man of technology. Yes, my website really is MrBicep.com. And you know, when your name's the muscle man of technology and your website's MrBicep.com, you got to put up or you have no street credibility. Anyway, we have some exciting giveaways today. I hope you enjoyed the presentations on healthcare tech and on hearing and on vision devices. And you're going to be able to find all the information today online that you saw all throughout the morning. The giveaways, part of the Get Connected Technology Fair for adults over 50, are always the big event. So let me tell you a little bit about today's awesome giveaways. And I wish everyone the best of luck. Okay, first of all, I don't know if you've heard of Car and Driver, but Car and Driver has a great magazine, and they also make a lot of fatigue monitor. And I'm going to open this up because let me tell you, I actually tried to get this out of the packaging and I'll never get it back in, but thank goodness you can see a little bit of what it looks like. But the Car and Driver Copilot fatigue monitor is going to help you avoid the effects of distracted driving and drowsy driving. And that is so important, especially like whether you're doing short or long road trips. Everybody today is not getting adequate sleep. Well, this is really going to help you because it's going to send out an alarm and really jolt you if you start nodding off. But it has a lot of state-of-the-art technology. And in fact, the Copilot will get your attention because it'll get a loud, beeping, piercing alarm. And the device also has the qualities of a real Copilot without having a backseat driver. But if you look closely, there's a lot of infrared lights in here that monitor your eyes. So this is worth a little over $100. It's a wonderful product. The second thing that we have is from Pelican, and this is a wireless charging case. And if you've never heard of Pelican, they really make some terrific quality items. This right here, if I open it up, you'll notice it has a Qi wireless charging stand, and this is a very, very powerful, I think it's a 10,000 milliamp battery, and just for comparison, your average cell phone is like 3 to 4,500 milliamps, so it'll charge any modern smartphone 2 times over. It's also waterproof for almost 3.5 feet for 30 minutes, so if you're the active type, you're going to love that. A wonderful product, and that is from Pelican. It is IP67 waterproof rated, by the way, so if you're the outdoor and beachy type, that's for you. Now, this next product I'm pretty excited to tell you about. It's the Muse S, and the Muse S is what we call the self-aware brain monitor, and it's going to de-stress you, and it's going to calm your racing mind and get you to go to sleep. They also have a terrific app, and on that app, you have sleep journeys and meditations. Choose Muse is the website, but again, they call this the truly unique meditation experience because it's a brain sensing headband, and this is what it looks like when you have it on. And on the back of this Muse S, you are going to notice that it has a lot of sensors built in. Relaxing and sleeping, I hope you're the winner of this product. Now, again, one of the last things that we have is the Sony, which is not going to be given away today, but Sony has this awesome, awesome headset that goes around your neck. And this is a wonderful device. You can hear ambient sounds. Now, as a reminder, there's going to be an additional opportunity to win this on Friday, October 23rd, and 2 winners will be chosen at random. And again, you'll experience television and movies like games like never before. You will absolutely love this in crystal clear sound. And now we have to get on to today's winners. So let's see who has won. Wait, it's coming in my ear right now. We have a winner. The Copilot right here is Ruth Ritchie. Again, the Copilot winner is Ruth Ritchie. Great product. Congratulations, Ruth. Next, who has won the Pelican G40C wireless charging waterproof case? The winner is Susie Jean Johnson. Susie Jean Johnson, you are the lucky winner today. And let's see who has won the Muse S brain sensing headband. Let me see. The winner is Janet Saunders. Janet, congratulations. Janet Saunders, you won the Muse S brain sensing headband. Congratulations to all the winners. I look forward to giving away more great prizes again tomorrow. Thanks everyone for tuning in.
What a fun day this has been. Thank you for joining us. Now, tomorrow's theme will be online security. Join us at 8:45 Pacific Standard Time. And remember, it is not too late to invite your friends and neighbors to learn with us. Go to SanDiegoOasis.org to register. See you in the morning.